Then we look at the disorders of the penis. We have balanitis, xerotica obliterans. Now, I'll not go into a lot of detail. Basically, this one, when you talk of balanitis, is inflammation of especially the gland. Yeah. And then, so mostly it is more of scarring. There's a lot of scarring, a lot of rigidity in the tissues of the penis. And then we have phimosis. Phimosis basically is narrowing of the periputial opening. So the prepuce, for those people who are uncircumcised, and even in children, that prepuce, the opening of the prepuce become narrowed because of most of the time because of infection and scarring. So actually that opening may completely block until urine cannot be able to come out. So when somebody urinates, the prepuce balloons because urine is filling inside and not coming out. And usually you will not be able to retract. Retract is basically to pull the foreskin over the gland penis. So because that place is so narrow, so you cannot expose the gland. So that is what we call phimosis. And usually the treatment for this, and mostly common in children, young boys, and so on, is circumcision. So you do circumcision to remove that foreskin. That will be treatment. Now that will usually is the treatment that we do for phimosis. And then paraphimosis is basically the foreskin is retracted. If you retract the foreskin over the gland, it acts as a constricting ring. So it is tightly around the penis, just above the glands, and acts like a tourniquet. You know, the way you will tie a patient, for example, when you're putting a branula on the arm, you tie with a tourniquet. So it forms like a ring around it. Yeah, and it can be so tight, it can even amputate the penis. So also this one, you'll have to do circumcision to prevent it. Of course, there is a manipulation that I think in one of the diagrams of how you can push using the thumb and even the forefinger to try and push it and retract it forcefully over the glands. Yeah. Then we can offer, of course, squamous cell carcinoma, because just like it has a skin like any part of the skin, it can also be affected by squamous cell carcinoma, usually located at the glands, so it can affect the glands or prepuce. So usually this is rare in circumcised men because most, as we say, tends to affect the prepuce and the glands. Yeah, for people who are circumcised, so it's a bit rare. So maybe this could be an argument to encourage men maybe to get circumcised, especially early, especially for those who circumcise early. It tends to be rare. And this one spread through the lymphatics to inguinal lymph nodes. So this is thought to be caused by chronic irritation and poor hygiene. This may be predisposing factors. And also it is associated with HPV. You remember HPV, human papillomavirus, that also causes cervical cancer. And we say cervical cancer to a great extent will appear sexually transmitted. So likewise with this one, human papillomavirus, so it can cause in male squamous cell carcinoma. So chronic irritation, poor hygiene, and that is why he thought, for example, in people who are not circumcised, because there is this smegma that is forming usually within the prepuce, the inside part of the prepuce. So if you don't clean it well, that is what is likely to cause this poor hygiene, is likely to predispose to that formation of squamous cell carcinoma. Then we have what we call erectile dysfunction or impotence, ED. Quite common. Usually it used to be common, especially in older people. People maybe who have had diabetes for very long, who have had hypertension that is not well controlled for very long. It tended to be common, but increasingly from my practice, I've had to see very many young men nowadays who are complaining of erectile dysfunction. Erectile dysfunction basically means the organ does not rise to the occasion, so to speak, as in during erection, either erection doesn't take place at all, or it takes place and then suddenly disappears. So that's what we call erectile dysfunction. Of course, there are so many causes. As we said, the first thing you need to do as a doctor, as a nurse, is to try and find out whether the diseases that is causing it. For example, you need to make sure somebody doesn't have diabetes that is not well controlled, somebody doesn't have hypertension that is not well controlled, because you see, as we have looked at the penis, it has erectile tissue that is full of, that usually blood should come in. So if you don't control hypertension properly or diabetes, then it may narrow the blood vessels. And so blood will not come into the penis for erection to take place. And also it may affect the nerves, because part of what causes erection is that during the intercourse, there is sensation that will cause the nerves to be sensitized, and then the erection takes place. So if nerves are numbed, then you are likely to have a good erection. And then, of course, more importantly, the brain. As I said before, that brain is considered as the biggest sex organ. So if you have, for the young men especially, they have performance anxiety and so on, they are likely to develop erectile dysfunction. So of course, we have not gotten to know exactly why it's becoming more common in young people. You find somebody who is not even married already complaining of erectile dysfunction. That they should be having an erection at all at that age, you also wonder why. And then we have priapism. Priapism, as I said, is painful erection, and that has no relationship to sexual stimulation. So you have an erection that is painful, that lasts more than 4 hours, and very painful. We call it priapism. There are so many causes, you can look at them. One of them, especially in children who have sickle cell, sometimes those cells block those vessels, and so you end up with pooling of blood that remains within the erectile tissue, and you end up with priapism. Yeah, so you can see there the carcinoma of the penis. You can see those are diagrams. It can be ulcerating, so you can have an ulcer. It can form cauliflower papillary tumor. That is on the right side is a specimen, a gross specimen. So somebody, of course, with a penile, the best treatment will be amputate, do penectomy. You remove that penis. Yeah, of course, it will be quite a challenge. So in that case, there was a penis that was removed. It had a squamous cell carcinoma and had to be removed. Yeah, so of course, after you remove, you probably put a permanent catheter in the remaining urethra. Thankfully, the cancer of the penis is rare. Personally, in my practice, I've not seen it. Yeah, I have not seen it. So we thank God that it's actually rare. And you can see now, if you were to look at it histologically, you can see formation of keratin part because of squamous cell carcinoma. Remember, there are keratins on the surface of the skin, but it can form as part of those cells that are cancerous. You can see squamous cells, walls of squamous cell. You can see the proliferation of the cells. So that will, if you are to look under the microscope, that is how some of the cells that you will see. Yeah, those are just diagrams to show paraphimosis. You can see in paraphimosis, you can see the opening of the external opening of the prepuce is tight and is very narrowed. So such a penis, you will not be able to retract it over the gland of the penis. So that is what we call phimosis. And of course, it can cause obstruction of even urinating. Yeah, and then of course, the treatment, as I said, is circumcision. And then we have paraphimosis. We say paraphimosis is there's a ring, or the foreskin form a ring around, just distal or proximal to the glans penis. And you can see on the left picture, on the left side, that is of the lower picture, you can see the way it is tightly. And then, of course, the next picture there is you are trying to reduce manually paraphimosis by countertraction between thumb and fingers. Of course, once you succeed with this, you're still supposed to go ahead and do the circumcision. And then next, we look at hypospadias. I'm sure we've mentioned this before, hypospadias and epispadias. When you talk of hypospadias, you're talking about the urethra opening below and the lower part. Or that will be, if you are to look at the penis, that will be ventral side. The upper part of the penis will be the dorsal side. This side, if you look at the picture on the left, the diagram on the left, you can see the opening. Those red places, those are the opening of the urethra. Yeah, so you can see one that is happening at the glandular one will be at the glandular region. You can see that is at the penile, and then you can see one at the scrotal region near the scrotum. And you can see one at the perineal region, number 5. So it can come out. Of course, these are congenital anomaly. And some children are born with what we call hypospadias. So you can imagine if you are to urinate in such, the urine will be able to come out lower. So it will not come out from the tip of the penis as it should. So that is called hypospadias. And of course, these are, if you look at number 3, 4, 5, those are severe accentuarial. If you have one that is number 1 and number 2, you may not even need to do any surgery. But generally, if it is severe, from number 3, 4, 5, you may need to do surgery and try to reconstruct the urethra to try to bring it to the tip. And there are ways of doing that surgery, usually done by urologists. And you can see on the left side, from the lateral side, you can see where the urethra is coming out for. You're looking at it from the lateral side. You can see the penile urethra is coming far away from, it's exiting from far away from the glands. And then the next we have Epispadias. So the second diagram on the right is Epispadias. You can see the urethral opening is at the upper part on the dorsum of the penis. You can see they are different. Usually they tend to have, it's congenital anomaly, they tend to have extrophy of the bladder. So the bladder, over the bladder is not closed, it's open. So you can be able to see the bladder directly from the abdominal wall. So we call it extrophy of the bladder. And this one also can be repaired. Thankfully, the most common one usually will be hypospadias. Epispadias is rare.